Welcome. I'm Renee Pinsky, Assistant Professor of Radiology at the University of Michigan Health System. I'm talking today about the breast density notification laws, information for primary care providers. Module 1 is breast density on mammography. The intended learning outcomes of this module include to become familiar with the origin and current status of breast density legislation, to understand what breast density is, how it's assessed, and how it is reported, explain to patients how breast density affects interpretation of their mammogram, and to apply an understanding of risk conferred from breast density to a personalized assessment of a woman's breast cancer risk. Breast density legislation began in approximately 2003 in Connecticut with a woman who was diagnosed with advanced breast cancer soon after having a negative mammogram. She did not know at the time that she had dense breasts, and in retrospect, she felt that she might have done things differently if she had known that she had dense breasts. And so this grassroots organization began, and it is now has been introduced in multiple states. 22 states have enacted legislation mandating patient notification of their breast density with their mammogram reports. 7 states have introduced legislation, and 6 states are working on legislation at this time. It's important to note that the black stars indicate the 2 states at this time which have mandated insurance coverage for the supplemental screening in states that have the legislation in place. The Michigan law was signed into law in January 2015, and it goes into effect June 1st, 2015. The important part of the law that your patients will be aware of is what is outlined in red. They will receive a written statement claiming, quote, "Your mammogram shows that your breast tissue is dense. Dense breast tissue is very common and is not abnormal. However, dense breast tissue can make it harder to find cancer through a mammogram. Also, dense breast tissue may increase your risk for breast cancer. The information about the result of your mammogram is given to you to raise your awareness. Use this information to discuss with your healthcare provider whether other supplemental tests in addition to your mammogram may be appropriate for you based on your individual risk. A report of your results was sent to your ordering physician. If you are self-referred, a report of your results were sent to you in addition to this summary." So this is what your patients will be getting with their typical mammogram report after their mammogram study is performed. So it's important to understand what breast density is. Breast density is a mammographic finding. It is a description of the variable amounts of fibrous and glandular tissue versus fat in the breast. Fat and fibroglandular tissue have different X-ray absorptions, and so the image that appears on the film is different depending on how much dense tissue is present. The density is the relative amount of the white and gray tissue in the breast. On your right is an image of an extremely dense breast where the amount of white fibrous and glandular tissue is far more than the gray fatty tissue. And on the left is a breast which is of the lowest breast density, fat density, where it's predominantly a gray or black image. Breast density is assessed and reported using the Breast Imaging Reporting and Data System, which is a standardized system to describe, in this case, breast density. The breast densities are divided into 4 categories. The lowest breast density, A, is almost entirely fatty, and that's to the left of your image. The next category is B, demonstrating scattered areas of fibroglandular density. C is what is considered heterogeneously dense. There is greater than 50% heterogeneously dense tissue in the breast compared to fat. And on the far right is the extremely dense breast, which is predominantly dense white tissue. The dense breasts referred to in the breast density notification laws are referring to the C and D categories, which are the heterogeneously dense and extremely dense breasts. So breast density is defined at the time of a woman's mammogram, but density can change over the course of a woman's lifetime. Things that can decrease breast density include increasing age. As a woman ages, it's typical that her mammogram will decrease in density. However, this is typically a slow change over time and not changing from one mammogram to the next. An increase in BMI or weight gain results in a dilutional decrease in breast density in that there's more fat in the breast than fibrous and glandular tissue, so the overall density is apparently decreased. Tamoxifen and other anti-estrogen type drugs can also result in a decrease in breast density. Different things can also increase your breast density. When a woman has a weight loss, decreased BMI can also result in an increased breast density. If a woman starts taking hormone replacement therapy, that can result in a rather quick change in breast density, something that can change from one mammogram to the next. And a woman who's pregnant or lactating typically has a denser breast than she would at her baseline. So who does the breast density notification law affect? This was a study that was done in 2010, and it had a large number of women. Over 600,000 women were studied, and they recorded their breast densities. And this is very typical of other studies that were done as well across the populations that have been studied. A very typical distribution is that the fatty breast and the extremely dense breast are each represent approximately 10% of the population. The greatest number of women with breast density have densities in the scattered density and the heterogeneously dense range. So it does follow relatively a bell curve where the least number of women are in the predominantly fatty or the extremely dense groups. So if you look at the groups of women that are included in the breast density law, we're looking at the two highest groups, and it's reported generally in the range of 45 to 50% of the population fall into the group that will be notified of having dense breasts. So why is having breast density important? It really is twofold. The first reason is masking. And what that means is that a dense mammogram can mask a cancer. The fibrous and glandular tissue shows up as white on a mammogram. Cancers show up as a white thing on the mammogram as well. So it's very difficult to detect a white object in a white background. If you look at the mammogram image on your left, this is a breast with scattered fibroglandular densities with an obvious mass, which was a cancer, standing out in this portion of the breast. If you look at the image on your right, this is a different woman who has extremely dense breasts. If that cancer were to have been placed in this breast, it would be very difficult to detect that mass against that background. So the sensitivity of mammography is decreased in women who have extremely dense and heterogeneously dense breasts. It has been reported, variable numbers have been reported, but the sensitivity of mammography in a woman with extremely dense breasts has been reported in the approximately 60% range and even as low as 50% range for women with extremely dense breasts, whereas a woman with fatty breasts, the sensitivity is generally in the high 80 to 90% sensitivity. This is another example. On the top are images of a woman with fatty breast parenchyma, predominantly dark fat, with a cancer in the upper central breast, which stands out quite easily against the fatty background. But if that cancer were to have been in a woman with extremely dense breast, such as you see below, it would be very difficult to pick that cancer out of a breast with that density. So masking or obscuring the cancer is an important component of why breast density is important. There have been strides made in terms of imaging women with dense breasts. The fact that digital mammography is now in more than 95% of the units in the United States are digital mammograms that are done as opposed to film screen is one of the reasons is because it is so good at looking at women with dense breasts. The digital mammographic imaging screening trial, the DMIS trial in 2005, was comparing film screen mammography to digital mammography. This was a very large trial, which the significant outcomes of this study were that digital imaging is more accurate in women with dense breasts, that's women who are greater than 50% dense, women who are under the age of 50, and women who are pre- or perimenopausal. And those all seem to run together more frequently. Women with dense breasts tend to be younger women, but that's not exclusively the case. But digital imaging is more accurate in these women. And women with dense breasts should attempt to obtain mammograms on digital machines. So the second component of why dense breasts are important is its effect on breast cancer risk. What you see on the left is from a study that was done in 2008, reporting 11 studies. It was a meta-analysis of breast cancer risk based on breast density. And I've blown up the important portion here of the graph, which corresponds to this over here. And this is showing the relative risk of breast cancer, with 1 being neutral risk, and above 1 being increased risk of breast cancer, and comparing the different categories of breast density, the extremely dense breast, the heterogeneously dense breast, and the scattered density breast. And the primary results that they reported for this group was that there was a 4x increased relative risk of breast cancer for women with extremely dense breasts. But it's important to note that they were comparing it to women with fatty breasts. So this is a valid measurement, but it is comparing two extreme small portions of the population to each other, which is less helpful in the general population of women and where most women fall. What was felt to be more helpful was comparing the extremely dense breast, the woman with the highest risk of relative risk of breast cancer, to women with average breast cancer risk. And that is somewhere, as shown on that bell curve that I showed previously, somewhere right between the scattered fibroglandular densities and the heterogeneously dense women. And so it is about a 2x risk for the women in the extremely dense group compared to fatty breasts. This was again reported in 2010, comparing the relative risk of extremely dense breasts and heterogeneously dense breasts to women who have average density. And on the bell curve, you can see here the heterogeneously dense and extremely dense population is compared to the average density, which is right between scattered and heterogeneously dense. And the numbers offered in this study was a relative risk for extremely dense breasts of 2.1x relative risk for extremely dense and 1.2x relative risk for extremely dense breasts. So there is an increased risk of breast cancer in these women, but it is of a relatively small scale.